Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
And welcome to Doctor's House Call. I'm Chuck in the morning, Chuck Holland. I'm sitting in for Mike Farrell this afternoon, who's got an appointment. And so I'm sitting in here with Dr. Robert Gear from Payson Health and Wellness Center. Good afternoon, Dr. Gear.
Well, good afternoon, Chuck in the morning. You're now Chuck in the afternoon.
Yeah, I'm confused.
All right.
It's nice to finally meet you.
Well, thank you. It's nice to meet you, too. I hear your voice all the time, and it's very interesting to see you, and you look so Western with your handlebar mustache and your little goatee there, and it's very, very much like the Old West.
Yeah, well, I try.
You do a good job.
Well, thank you.
You know, today we're talking about sharper, dementia-free brains, brain function, thinking, and stress, problem caused by the body, mind, or food. Find the reasons, get the correction, and rebuild, fix it before you lose it. That's a good thought, isn't it? Fix it before you lose it.
That's a good motto to have, absolutely.
It is. You know, once you lose a tissue in your body, it's pretty darn hard to get it back because it's gone.
Right.
Now, if you still got some left, you can rebuild. Isn't that nice?
Yeah.
It's
Thank
possible.
God for that.
And the more we're learning about the chemistry of the body, the more we're learning how to rebuild the tissues of the body. But the most important thing is we have to get blood flow to that tissue. Because if you don't have blood flow to the tissue, you can't get the healing chemicals there. And if you can't get the healing chemicals there, those cells don't start working like they're supposed to work. And so you've got disease.
I see. Well, yeah, so use it or lose it then, right?
That's it, exactly. So in Dr. Wyrick's brain-based training, he uses documented treatments in which research has shown improvements in chronic pain, stabilized emotional health, and reduced sleep irregularities. Specific vestibular-targeted activities, advanced neurofeedback approaches, oculomotor vision-specific exercises based on advanced technology, photobiomodulation, laser therapy, and exercise and functional medicine optimization are components of his recovery programs. Boy, Dr. Wyrick, those are a lot of big words.
Yeah, I was just thinking I probably should have gone to school a little bit more.
Yeah, well, we'll get around to talking about some of them later, but I'm much more limited in what I want to talk about today.
Well, you know, last week we talked about epigenetics, Dr. Wyrick, and its relation to anti-aging. Stress is an epigenetic factor that affects how fast we age. Today, we're going to talk about some new non-drug treatments using a medical device called biofeedback and mind-body techniques that we offer at Payson Health and Wellness Center. Dr. Wyrick, what is stress?
Well, stress is any force that we experience that puts a strain on our body, mind, or spirit. The stress can be environmental, such as a difficult job, or it could be internal, such as beating ourselves up. Either way, the result is a negative impact on our health, our mental clarity, and our feeling of well-being. Sometimes we can reduce the stress in our lives by, for example, simply changing jobs or changing our self-talk.
Well, before we go on, you know, anybody that wants to call us needs to give us a call. And Chuck in the morning, now you're in the afternoon, what phone number is that they should be calling on?
Well, the number is 474-2427, and we've got open lines now.
And if they're out of state or out of the Payson area, you got to put 928 in front of it, don't they?
That's correct, yeah. And a 1.
And a 1.
And a 1.
1-928-474-2427. 2427, right. So all of you who are listening on the internet from Casa Grande or my sister in Valdosta, Georgia, or the Phoenix area, or wherever. And we have people listening from all around, maybe even in Saudi Arabia. So give us a call. Dr. Wyrick, if you can't control the stresses in your life, what do you do?
Well, in that case, then we have to change the way we respond to the stress. We need to increase what's called resilience. So it's not the stress that makes us ill. It's the strain that is placed on our body by our ineffectual response to the stress. For example, here's an analogy. Suppose we are a tree limb, and somebody comes along and applies stress to us to try to bend us. If we are a young green tree limb, we are resilient and can bounce back. If we are a dry old limb, we will be strained to breaking.
Yeah, well, that's nice, Dr. Wyrick. That's okay, but how can we become more resilient?
Well, some people try to cover up the strain by using prescription pharmaceuticals or substance abuse. That approach generally clouds our thinking and accelerates the aging of our brain. But there are various mind-body techniques that people can practice, like yoga and Zen meditation. But these really take years to master and don't necessarily fit the worldview of most people here in Payson. But I'm excited, really excited, to talk about another way that we are now able and offering at Payson Health and Wellness. But first, I need to talk a little bit more about how our bodies work, about our physiological, hormonal, and biochemical responses to stress.
That's a fact. We need to know how to find and treat the cause, rather than just the end result of being strained to breaking. That's the meaning of the word physician. It means someone who understands the physiology of the body. It means understanding how structure, chemistry, and emotions all interact in the body, and then knowing how to best balance all those factors to optimize our health and resilience. Dr. Wyrick, tell us about the physiology of stress and our body's response.
Well, the most widely discussed aspect of our body's handling of stress is what is called our autonomic nervous system, which is sort of like autopilot. We don't really think about it usually. It's part of our brain, nerves, and endocrine glands that control whether we are calm and relaxed or revved up for a fight. When we are calm and relaxed, we are at a state that's called the parasympathetic state. In this state, the body sends blood to our digestive organs and we are mellow. But if a grizzly bear suddenly appears, our brain signals to the body that it is time to fight the bear or run away. Blood flow to our digestive tract is reduced, and blood flow to our muscles is increased, and our heart rate increases. We call this the sympathetic state.
So the sympathetic state causes stress, is that it?
Yes, it does. Or stress causes the sympathetic state to be aroused. It's sort of a chicken and the egg thing. The stress causes the body to enter into the sympathetic state. The sympathetic state strains our body.
It sounds like the sympathetic state is harmful. Why is the body designed to do this?
Well, if we have an immediate need to avoid being eaten by a grizzly bear, the sympathetic state is a good thing. But in that case, it doesn't last long. Either we successfully respond to the grizzly bear or we become the bear's lunch and don't have to worry about the strain of being in a sympathetic state for very long. But in our modern society, we don't have to confront grizzly bears very often. Instead, we have the constant pressure of worrying about everything from being mugged, getting COVID, being taxed, or reliving traumatic experience as in PTSD. We live in constant stress, and the strain causes a multitude of diseases such as high blood pressure and accelerated aging. Dr. Gear, can you tell our listeners more about how the body controls the parasympathetic and sympathetic balance?
Well, according to the anatomy texts that I have read and studied and been tested in, and the physiology, functional neuroanatomy, it is the hypothalamus and pituitary glands that are parts of the brain that control many of our hormones in the body. And for today's show, let's just focus on the hormones cortisol, adrenaline, and DHEA. Adrenaline is the hormone that is released into the blood by our adrenal glands when we need to run from a grizzly bear. Adrenaline puts our body into a sympathetic state. Cortisol is another hormone released by the adrenal glands to help our body to cope with stress. And Dr. Wyrick, tell us about DHEA.
Yes, there's more to our response to stress than just the cortisol and the adrenaline. DHEA, which has a really big scientific name that I'll throw out just for fun, dihydroxy, and I messed it up. Dihydroxy.
Boy, I'll tell you, I've never heard you stumble over a chemistry, biochemistry word with your PhD and all that. You got too many words running around inside your brain.
Dihydroxy.
Maybe you got too much stress going on. How's your cortisol level right now?
Well, it's rapidly climbing.
Boy, I'm glad you didn't ask me that, because I'd do even worse. It'd be dead silence.
Dihydroxy epiandrosterone.
Oh, you got it?
Yes.
Say it again.
Dihydroxy epiandrosterone.
Holy cow.
Wow.
Okay.
And the androsterone is important because it is the precursor of testosterone and estrogen.
Oh, I heard that as aldosterone when I was in school many years ago.
No, that's a different word.
You now pronounce it differently than I did, so it's the same thing, it's the same chemical, and it still comes from what gland?
The adrenal glands.
The adrenal glands. And where do we find so many people having structural problems in the lower thoracic spine?
Yeah, that would be where the nerves leave the spine to go to the adrenal glands.
To the blood vessels of the adrenal glands, that's right. And if they don't get their blood flow, they can't make these stress hormones and they can't balance out. And then if the hypothalamus and the thalamus and the pituitary aren't working right, holy shoot. I almost said something else. Holy shoot. Then the person is sick. And they start to develop dementia.
Interesting.
Yeah, it's a fact.
Wow.
So, Dr. Wyrick.
So the DHEA is another hormone that the adrenal glands make when the body is not under stress. And the stress can take the form of depleting emotions like anxiety or depression and many other emotions that just sap the strength out of our body. And these depleting emotions cause an increase in cortisol and, conversely, a decrease in the DHEA because the body can't make both at the same time.
Why can't it make both at the same time?
Well, because you really want the big words?
Well,
basically, they all are in the same steroid biosynthesis pathway. And if you're making one thing, you can't make the other because it uses the same precursor.
What's a precursor?
Something that came before.
Is that cortisone?
No.
What is it?
Ultimately, cholesterol and then pregnenolone. And
I thought cholesterol was bad. I'm being a devil's advocate right now.
Well, that's a conversation for another day, but cholesterol is essential. Our body would not work without an adequate supply of cholesterol.
Yes, if you take anti-cholesterol drugs, you may be screwing up your stress response.
Among other things, yes.
Yeah.
And your sex hormones.
Holy cow, we don't want that, do we?
Whoa, now you're hitting home with me.
So go on, Dr. Wyrick.
Okay. So, on the other hand, there are restoring emotions like joy that do just the opposite and increase our resilience. So, with that background, I want to talk now about a less widely known approach that greatly improves our ability to control our response to stress. and increase our resiliency.
Okay, go for it.
Okay. So, in addition to the hypothalamus pituitary adrenal system, the heart and respiratory systems are also involved. Most people think that a healthy heartbeat is like a metronome. Tick-tock, 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 always the same. That is not true. The heart rate increases when a healthy person inhales, and the heart rate decreases when a healthy person exhales. And this is normal physiologic function. And we refer to this phenomena as the heart rate variability. And it's controlled by the brain stem and the part of the brain called the thalamus. And these all work together to communicate with the heart and lungs. And the heart and lungs or the heart especially, communicates back up to the brain. And during each breath cycle, the heart rate of a healthy person, a young healthy person, can vary by 20 or 30 beats per minute.
You know, this just proves the necessity of having good blood flow to the base of the brain.
Oh, yes.
And to the brain stem. And so many people got their blocks knocked off when they were kids. They got their heads screwed on crooked, and it interferes with the blood flow of the vertebral arteries going into the brain. And if you shut down 1%, 2%, 3% of the blood flow of these two arteries that supply 30% of the blood to the brain, what happens to the brain when you start reducing that? People start to get irritable. They start to get anxious. They start to have all kinds of emotional problems because they don't have good blood flow to the brain. It's not a stroke, and it's not a transient ischemic attack per se, but it's kind of like a transient ischemic attack, but it's constant all the time because they got their old whiplash injury from a football getting flipped on their butt, knocked ass end over apple cart, got bucked off a horse, fell off a bicycle, fell down a mountainside.
Or in my case, hit the wall too many times in the race cars.
Yeah, exactly.
Yeah.
Because you get bounced around. And if you don't get your neck straightened out after that, then you start to have some lowered blood flow, and it affects the functioning of the brain, and you get old too soon, mentally old too soon. So Dr. Wyrick's been talking about all this kind of stuff that relates directly to that. You can't have good function of the tissue without good blood flow. And you might think you've got good blood flow, but if you get examined by some of this equipment that we've got in the office, you'll find out that you don't have the good blood flow you thought you had. Most of the time, we find when we run the myovision on people that there's a problem with balance of the muscles because of lack of blood flow. Dr. Wyrick's got some very specific equipment for looking at brain function. He's going to talk more about that here in just a minute. I'm going to blow his cover just a smidgen here. You can look at this thing on the computer screen, and you have a little connector hooked up to your head, and you got to make the little dot move to different places. And as soon as you've got your brain working correctly, you can do that pretty easily. All with brain waves being picked up by a little instrument on the head. So, Dr. Wyrick, go for it.
Okay. So here's an example of heart rate variability, or an analogy, I should say. You can think of heart rate variability as being like a ballroom dance between the heart and the lungs that are synchronized to the music of an orchestra. Think thalamus and brainstem as the conductor of the orchestra. So let's imagine two of the greatest dance artists of all time, Fred Astaire and Ginger Rogers. They could dance in amazing, well-coordinated motions, sensitive to each other's motions, as well as the music being played. The technical term for this is coherence, the opposite of incoherence. But now imagine that instead of dancing to the music of an orchestra, they each had headphones on that played different music. Think, for example, of Fred Astaire hearing the Strauss Blue Danube Waltz, which is in 3/4 time. And Ginger Rogers is hearing a foxtrot in 4/4 time. And just for good measure, let's put blindfolds on each of them so they can't see what the other is doing. So, while these great artists may still manage something that looks like they're dancing together, I imagine the results would be rather incoherent by comparison with their normal grace.
Well, why is heart rate variability important, Dr. Wyrick?
Well, research shows that people with relatively high heart rate variability handle stress better and live longer.
Is there a way for people to increase their heart rate variability?
Yes, traditionally, years of practicing yoga, breathing, or Zen meditation can help a person to increase their heart rate variability.
Most Americans don't have that kind of patience. There's a few of them that do. When I was very young, I studied a lot of yoga and yoga breathing and Zen meditation, and I got pretty good at it. So, is there a supplement or drug or some kind of something that can speed up the learning process?
Not that I'm aware of. I know of drugs that can cover up our response to stress, such as Xanax and other benzodiazepines, but these are addictive and are associated with increased incidence of Alzheimer's disease. Beta blockers and other medications that are used to treat high blood pressure actually reduce heart rate variability. But what I'm really excited about is a totally different approach that uses a technique called biofeedback, which I am trained in. In fact, I am board certified in neurobiofeedback by the Biofeedback Certification International Alliance. I have to put that legal disclaimer in.
So, Dr. Wyrick, how is this better than weed? Than, what's the other word for weed?
Grass?
Grass? What's the other word for grass?
You mean marijuana?
Oh, yeah, marijuana. Mary Jane. How does this work, and why is it better than Mary Jane for building the brain function and meditation and such?
Well, marijuana, just like Xanax, is a form of a drug, and it doesn't fix any problem. It simply papers over the problem. So
but people who do it say, oh, I've learned so much. I'm so much more artistic now. I'm so much more into myself.
Well, I honestly can't speak to that because I don't partake. So.
Well, neither do I, but I've talked to a lot of people and I've heard a lot of stories. However, when I first learned homeopathic medicine, and I'm going to digress for just a moment, but it's not very far, there was my first patient who came to me. He said, when I was in high school, I was an A student. I was into everything. I was into politics. I was president of my class. I did all kinds of that kind of things. And then I got drafted and went to Vietnam. And in Vietnam, we were loaded with marijuana. And I smoked a lot of marijuana. When I got out of the military, I came back into town, tried to get back into my old ways of doing things, and I just didn't give a shit anymore. Mm-hmm. I was really hanging out, just coasting around doing nothing. I've done that for a couple of years now, and I don't want to do that anymore. So, Dr. Gear, what can you do to help me get better? And I looked at him and I said, well, I just learned about this thing called homeopathic medicine. I spent a lot of time, a lot of effort. I said, tell you what, and I had no idea what I was looking at, but I said, go get me, and I'd heard this term before, go get me a nickel bag of marijuana. So he brought back a little sandwich bag with some marijuana, he said to me, marijuana seeds and leaves and stems all mixed up in it. And so I took that, and I put it into 180 proof alcohol. I let it sit overnight. And then I took that liquid that I decanted, I poured it just a liquid, and I mixed 1 cc of that with 9 cc's of alcohol. This is this drinking alcohol, not the rubbing alcohol. And I did that 9 times to give me a total of 10 dilutions.
So that was in homeopathic terms, a 10x potency.
Correct. And in mathematical terms, if we're looking at Avogadro's number, that would be 6.023 times 10 to the 10th power.
Yes.
in a number of molecules that
Yes.
were present of this cannabis concoction of tincture, which is an alcohol extraction from the cannabis called a tincture, as opposed to a tea or an infusion, which is a water extraction.
Like coffee.
Like coffee, yes. So I gave him this, and I muscle tested him, found out that it was just right for him, and found out how often to take it. So I gave it to him. He came back a couple of weeks later and says, "No, it's not working. It's not working." I said, "Well, stay with it." So he did. Came back a couple more weeks, a month later. He says, "Your stuff just isn't working for me at all. But I re-enrolled in college, and I'm into learning CPA type stuff. But my stuff didn't work." Now, isn't that an interesting little story?
Yeah.
That was my first experience with homeopathic medicine. And after that, I got 3,000 different homeopathic medicines in my pharmacy. I was able to do a tremendous amount of things with people using homeopathic medicine to change the energy field of the epigenetics of their DNA, because energy medicine works. But it is like, I'm going to use this analogy now, it's like a sniper at a mile with iron sights hitting the bullseye. How difficult is that?
Right.
You have to be out in space in order to get a bullet to go from your rifle a mile away into the bullseye. Now, I've talked with people who were in the Army and in the national, what is it called, target shooters.
Mm-hmm.
There's a group of those guys that run around the country. And they said, yes, we can do that, but you have to be in the zone to do it.
Mm-hmm.
Ah, now you're talking my language.
Aha. Now, you're going to tell us a little bit about the zone, aren't you, Dr. White?
I am.
This is how our brain learns something.
Okay, so how does biofeedback work to improve the coherence? Well, I have a computer that can measure a patient's changing heart rate in real time and show to the patient how coherent their breathing is and their heart rate. Okay, so remember, the more coherent the heart rate is, the better the patient's ability to handle stress without being excessively strained. Because the patient gets feedback from the computer as to what's going on in the patient's body and how much or how little coherence the patient currently is experiencing, it's much easier for the patient to learn how they can get into a coherent state when they need to, when they're faced with stress.
Oh, Dr. Wyrick, that sounds so complicated.
Well, as a doctor, I have to understand the theory. The good news is the patient just watches their coherence change on the computer screen as I coach them on how to get into a coherent state and stay there. The computer technology helps the patient visualize what is going on inside them. It is much easier to learn if you can see how your thoughts and actions affect the outcome.
So give us an example of how biofeedback helps us become more coherent.
Okay, so here's an analogy. Imagine that as a child, when you were being taught to write, the only writing instrument you had was a pen, but the pen didn't have any ink. You could try to watch what the teacher was doing on the board and repeat the same motions with your pen, but you would get no visual feedback as to whether you were doing it right. How long do you think it would take you to learn to write under those circumstances?
Well, I can see how getting immediate feedback would make learning much faster and effective. Dr. Wyrick, did you say you have this technology over at the office at Payson Health and Wellness Center?
Yes, and any listener who's interested in a free 15-minute demonstration can call our office during business hours to schedule an appointment with me. Just call 928-474-7409 and ask for a free 15-minute heart rate variability consult with Dr. Wyrick.
If you can't remember heart rate variability consult, just say, I want to see Dr. Wyrick for that computer thing for my brain.
Yeah, that'll work too.
So that's pretty phenomenal. You know, if I had had biofeedback training, I wouldn't have had to have spent a couple of years learning yoga meditation and learning all that I did. But many years ago, during one of our naturopathic medical conventions, scientific presentations, there was a gentleman there presenting this same thing that you're talking about. This is, 40 years ago now. And I sat down to do this work, put this little thing on my head to check my alpha waves, and he found out I was right in where I needed to be for my brain to be picking up parapsychology, to be able to pick up thoughts. And I was pretty good at all that stuff, which is one reason why I'm pretty good at divining what a patient needs when they come in and start to tell me something. I sense things, and it's because I studied all of this. So if you listeners out there want to get better at this sort of thing, you need to come in and get your brain trained and learn coherence. And learn, then you can take another step, and you can learn how to move the mouse around on the screen and make it do things you want it to do, which I kind of did with my teachers in school. When they were up at the blackboard, I would think strongly to them, and they would do the things I suggested to them. And I did that a lot in a lot of other areas. And finally, I was at a meeting in a line with some other doctors, and I started to look at one person and present something to them. And then I felt somebody else presenting something to me. And I thought, oh boy, that is an invasion of privacy. So I stopped doing that. I stopped trying to make other people do things. But I was getting pretty good at it.
You know, there's another story along a similar line of a very famous psychologist by the name of B.F. Skinner, and who taught about operant conditioning. And his students decided to put him to the test, put his theory to the test. And so when he was on one side of the classroom writing on the board, they paid rapt attention to him. And when he got over to the other side of the board, they just kind of ignored him, stared off into space. And by the end of the class, they had gotten him in one little corner of the blackboard and not using the whole blackboard. And he didn't even realize what they were doing to him.
It's kind of like training a dog, isn't it?
Wow.
Here's the treat for the dog. Mm-hmm. So, yeah, all these things are possible. We've learned so very much during my lifetime about the brain function. I just love it. You've been practicing over 14 years, Dr. Wyrick. You're board certified in neurofeedback by the Biofeedback Certification International Alliance, and you're also board certified and as a practitioner, diplomat in the clinical science of anti-aging by the American Board of Anti-Aging Health Practitioners, and you're board certified in, I'll say PhD, chemistry.
Yeah, not a board, but a earned PhD in chemistry.
Well, I think that the college that you went to was better than a board. That was University of Tennessee at Knoxville.
Yes.
That was a real prime university. It was not just a mail order diploma.
No. I worked hard for that degree.
You certainly did. And you have a primary interest in internal medicine with a special interest in endocrinology. That's the hormones of the body. And there's lots of jokes about that. I'm not going to get into that.
Oh, no, please don't.
So the hormones modulate the brain function. And food allows us to have good hormone functioning. And toxins in the food are bad, and we don't even know what they are. So here's a quote from the March 19th, 2021 of Consumer Affairs newscast by Mark Huffman. A study by researchers at the University of Buffalo has linked prescription drugs with falls by older Americans. The researchers found that 95% of the drugs taken by seniors increase the risk of a fall. That's toxins. The study found that medication to control high blood pressure is most likely to cause falls. That's their research. If you are trying to limit your consumption of pesticide traces found on food, researchers say you might pass up the strawberries. The fruit had the highest traces of pesticides in a study by the Environmental Working Group. Researchers also found higher levels on spinach and kale. So you can learn more about that at consumeraffairs.com.
Yes, I will say, though, that the Environmental Working Group has some rather peculiar scientific theories about how to measure things, and I don't support all of their work, but certainly they are a canary in the mine.
Well, that's part of your discipline in being a PhD scientist, is you question things, and not everything that is presented is going to be accepted by every scientist listening to it. So we do have a little bit more information here, and I'm going to list some citations. Dr. Wyrick, what is a citation?
Well,
is that a reference?
It's either a speeding ticket,
which I'm quite familiar with,
or in scientific literature, it is a reference to some book or journal article that supports some statement being made in the paper.
Right. So, in the link.springer.com article, and I have the numbers here if anybody's interested, and in PubMed, NCBI, National Institute of Medicine, National Institutes of Health of the Government of the United States, and there's another number here, and ScienceDirect.com and Science article, abstract, and another long number, and PubMed, National Institutes of Health, National Library of Medicine, another long number, and the NCBI, NLM, NIH, that's the National Institutes of Health.
Yes.
And then PubMed, National NCBI, NLM, NIH. There's 4 more reference points here. So this is a well-referenced document that I'm going to present to you.
Let me say a word, though, about PubMed. PubMed is run by the National Institute of Health, but it is the go-to collection of peer-reviewed literature in medical science. So if a paper has been accepted by a peer review, that means other scientists have read the paper and said, we agree with the methodology, we agree with the conclusions, this is good science, then it merits getting cited in PubMed. So if it has PubMed in its name, it's good stuff.
And that's not the same as Club Med.
No.
Okay, good. Just want to clear that up.
My sons worked at Club Med in the Bahamas during their between their junior and senior year in high school. One of them,
boy, that had been fun.
Helps the people learn how to use a trapeze. Isn't that interesting? So, the things that I just mentioned to you are part of what I'm going to tell you about now. So the studies indicate that, let me find my first page here. Boy, I'll tell you, taking notes and having a lot of different notes is quite a process. Okay, take this amino acid for a sharper brain, even if you already have Alzheimer's. According to Lee Euler, publisher of Brain Health Breakthroughs newsletter, in Volume 3, Issue 792, an amino acid may hold the key to treating and preventing a wide range of brain problems, including dementia, Alzheimer's disease, and depression. Its secret is a unique ability to energize brain cells. The effect is similar to what happens when you add an octane-boosting additive to your car's gas tank, an additive that supercharges the power your engine gets from its fuel. That's what this amino acid, Dr. Wyrick, you love amino acids, acetyl L-carnitine, ALC, does for the cells in your brain and other parts of the body. In fact, the latest research shows that acetyl L-carnitine can sharpen your thinking, even if you already suffer with Alzheimer's disease.
Could I say a little bit about the science of that? We have mitochondria in all the cells of our body, and in particular in brain cells, that make the energy for the brain cells to work properly.
That's right.
And
your body makes acetyl L-carnitine from L-carnitine to turn fat into energy.
It helps.
Specifically, ALC shuffles fatty acids into cells across the membranes of the mitochondria. Those are the energy-producing organelles in each cell. for use in cellular energy production.
And this is important because as the brain ages, especially under circumstances where we have diseases like Alzheimer's disease, the brain seems to lose its ability to use sugar as fuel. And so it can switch over to using fatty acids instead, but in order to make the fatty acids available to the brain cells, we need the L-carnitine.
So ALC is crucial for energy production. Researchers believe that high levels can keep neurons in the brain firing on all cylinders and allow them to communicate with each other more rapidly. A study in Italy looked at people's ALC levels and found they were lower in those who were suffering from memory problems. In this study, researchers measured the ALC in people whose brains were functioning normally, in others who were suffering from mild cognitive impairment, a condition that can be an early sign of Alzheimer's disease, and in people who were suffering from Alzheimer's. Their investigation led the Italian researchers to conclude that the very lowest levels of ALC in people with MCI,
mild cognitive impairment.
That's good, thank you. ALC is what was it?
Mild cognitive.
No, ALC.
Acetyl L-carnitine.
Good.
Which, by the way, the word carne in it sounds like the Spanish word for meat. And this is something which is rich in meat, but not really found in vegetables.
So you have to take a supplement if you're not eating meat. Now, this means that those people that have low levels are at the highest risk of Alzheimer's disease in that study, in that investigation over in Italy. So ALC, what is that again?
Acetyl L-carnitine.
Also helps keep neurons' membranes intact by lowering the threat of oxidative damage. Now, Dr. Weyrich, we talked about oxidative damage in the past, didn't we?
Hey, we did.
So in addition, ALC protects the synapses between the neurons. That's where signals are exchanged. The synapses are packed with mitochondria. And those are the little spaces in between the neurons, and that's where the electrical energy goes from one neuron to another by a chemical messenger.
Right, called a neurotransmitter.
Exactly.
And there are a number of different neurotransmitters like dopamine and I won't list all of them, but there's many different neurotransmitters that are important.
So a study in the Middle East shows that ALC can increase the regeneration of new neurons and other nervous system tissues by promoting the health of stem cells.
So is this a supplement that you can buy over the counter? Or?
Yes, it is available in health food stores.
Got it.
Now, you have to remember this, though. If you don't have good digestive enzymes, you may not be able to get it into your bloodstream. And if you are eating foods that make an IgG antibody, you may have a thickened mucus lining on your intestinal tract that prevents you from getting that type of protein across into the bloodstream. So you have to look at the ability to digest food. You have to look at the ability to motivate it through the wall and get it into the bloodstream before it even has a chance to get to the brain. Then you got to get your block knocked back on straight so that you get good blood flow to your brain.
Right.
And now you're ready for this to work if there are no other toxic chemicals in you like heavy metals. And we can do a hair analysis to find that out. Other tissue can be used, but most people don't want to have their fingernails pulled out by the root, and they don't want to have their bones punched in order to find out what they have heavy metals.
If I could avoid that, I would probably want to. Go ahead and take some of my hair.
So a little bit of hair, and we find out heavy metals.
Mm-hmm.
A little bit of blood, we find out a whole lot of things. A little bit of urine, we find out a whole lot more things. Dr. Weyrich's got a whole program for anti-aging where he looks at all these things. And then I look at the person's structure to make sure that they don't have any impediment to blood flow. So between the two of us, as he says, we're like Jack Sprat and his wife.
That's quite a tag team.
Yeah.
And by the way, acetyl L-carnitine is only one of a number of beneficial supplements and so forth that are available that have demonstrated efficacy in rolling back the Alzheimer's clock. And they work best in what's called synergy. So choosing 5 or so different interventions that complement each other is much more powerful than one at a time. Part of the problem with modern medical science is they are very reductionist, and they use the scientific method where they only change one thing at a time. And so if the effect is really powerful, then they'll see a benefit from just acetyl L-carnitine. But there's a number of other interventions that you add at the same time, and you get a much stronger effect than any one of them. And in some cases, they say, well, we tried that and it doesn't work. Well, they tried it as only one intervention, keeping everything else exactly the same. And it's like trying to build a house with a box of nails but no lumber.
So we're going to go back to our talk about our studies that I mentioned earlier. And one of the studies indicates that when the body tries to regenerate damaged neurons in the brain, stem cells are often injured and die off at the same time, limiting the body's regenerative abilities. This die-off occurs when stem cells are done in by extreme stress to their mitochondria. So as mitochondria are cut off from what they need to produce energy, which can happen during a stroke or traumatic injury, or like I mentioned to you, getting your block knocked off and interfering with blood flow through the vertebral arteries and getting a transient TIA, transient ischemic attack, because of a whiplash injury or something like that. They may start the process called apoptosis, or pre-programmed cellular self-destruction. Holy cow, they commit hara-kiri.
That doesn't sound good.
So the researchers say ALC, what is that again, Dr. Wyrick?
Acetyl L-carnitine.
Can help the stem cells survive by keeping their mitochondria from pressing their self-destruct button. Isn't that wonderful? They act like your lover coming up and grabbing your hand and saying, "Don't go away, don't leave me, stay here." That's what acetyl L-carnitine, is that the right word?
Some people say acetyl, some say acetyl.
I learned a different language than you, but it says the same thing.
Yes, yes.
Okay, so now we have this next item, improved brain function in Alzheimer's patients by 30%. It's another study about this acetyl L-carnitine. In a remarkable clinical study out of the University of Massachusetts, oh boy, I had fun with that word when I was in 8th grade, was it? I was in a play. I don't know, maybe I was in 7th grade. I was in a play in grade school. And in this play, we were talking about the Tea Party. And in the Tea Party, that occurred in Boston, Massachusetts. I said, mass of two shits. Because I couldn't hear properly because of all the infection in my ears, because of all the milk that I had been forced to drink, because it was supposed to be good for me, caused lots of problems. I'll tell you, you just don't know what you're doing to children if you don't take care of their problems correctly. And it's not taking drugs to cover it up. It's finding out what the problem is and then fixing that. And if it means don't eat certain foods, it means don't eat certain foods.
Yes, there's an article in the peer-reviewed literature published in the British journal Lancet that showed that for treating children's ear infections, homeopathy was more effective than antibiotics.
Absolutely. In fact, dietary control fixes middle ear infections better than anything else. And if you get a kid who's got their neck twisted and then they start to have a problem in one ear and not the other, it's not a systemic problem. It's not coming from the gut. It's not coming from some infection. It's coming because there's not good blood flow in the nasopharynx, the back of the nose and the throat, where the eustachian tube, that's the tube that runs from the ear down into the throat, is being blocked, and the fluid that normally moves through the middle ear to keep washing things out of it and not letting infections happen gets blocked. And pressure builds up, and now the poor child is having this earache because they've got a twisted neck. And then they go to the MD, they give them an antibiotic, or they do this or that and the other, and they don't fix it. But eventually the body kind of subsides a little bit, but the problem is still there. The twisted bone in the neck is still present, and it builds up scar tissue. And I could go on. That's another show, Dr. Weir.
Oh, yes.
Boy, I'll tell you, we get into all that stuff. So now, in this clinical study out of the University of Massachusetts, researchers found that ALC supplements can help slow the mental decline of people with Alzheimer's disease. Researchers found that by giving folks with Alzheimer's disease ALC together with folate, vitamin B12, alpha-tocopherol, which is vitamin E, S-adenosyl methionine, and N-acetylcysteine, they improved the brain function by 30%.
Yes, that's an example of the synergistic combination of a number of nutrients.
And it slowed the worsening of their cognitive abilities.
And I've got a paper that shows people with Alzheimer's that had lost the ability to balance their check after following protocols similar to what you just mentioned, actually being able to go back and work again and balance their checkbook.
I told you in one of our shows in the past about Minabelle James. I can use her name because she's been dead a long time. This is back in the 1970s that I treated her. We were doing intensive daycare at that time. I was bringing people into the office and keeping them there all day long with hospital bed and nurse, and we gave them full therapies twice a day, monitored their intake for lunch, and told them what to have for dinner and breakfast. Poor Minabelle James. When she first came to me, she didn't hardly know what her name was. She could hardly walk. She couldn't do housework. She couldn't add 2 and 2 together. She's in pretty bad shape. Her husband said, "I've loved her for years. I wasn't too kind, so would you please take care of her and bring her back for me?" I said, "Well, sure, I'll do this." Here I was, right in my mid-30s, and I was full of it,
Right.
Boy, I'll tell you, I knew everything that I needed. Did you know what happened? We did everything for her, and at the end of 2 months of care, she was doing her taxes. She was doing her light housework. Here she was in her mid-70s, and we were rehabilitating her.
Wow.
And she's my prime patient example. Mm-hmm. I wish that I had the ability to do this with everybody, because we have to have them in a controlled environment, but the politics of medicine does not allow me to be in that environment. However, there was a bill passed in the legislature just this last week, SB 1016. And our legislators, the senator and the 2 representatives, voted for this piece of legislation. And there were a lot of pages to it, but at the very end of the things that it did, it said naturopathic physicians can work side by side with MDs and DOs in a center funded by the health department of the state or the county or municipality, or in a nonprofit organization. That's
Wow.
a first.
That's some good news indeed.
Now, we've been licensed in Arizona since 1934 legislation. My aunt and my father got into the profession in 1935. I got into it in 1964. And nothing changed in this profession from 1934 legislation until I made it happen in 1981. And we got the word physician added to the naturopath. So we were naturopathic physicians instead of naturopaths. Giant leap. Mm-hmm. And then I got threatened with being killed in the chambers of a Superior Court judge if I stayed in politics. He told me that's what was going to happen. He was friendly to me. That's why he told me. Mm-hmm. So I stayed out of politics because I had made that change and had done some other things, and I wasn't liked very well by the head politicians in the state. So in 1988, I was able to go back in. In 88 and 89, we made naturopathic medicine and surgery because of special circumstances and my literally living down there at the legislature to make this happen. We had 16 bills get through the legislature in those 2 years. All of them but one were signed by the governor. The MDs put everything they had to stop the one, and that one did say that naturopaths could be paid the same for the same service as an MD or a DO. And they stopped that bill because they didn't want us to be paid the same.
Good old boys club.
Oh, yeah. Anyway, that's what happened back then. Now, can we change brain function? Damn straight we can change brain function. Can we make it better? Yes, we can. But we have to really work hard at it. We've got to get all the waste out of the body. We've got to put food into the body that's not poison. We've got to get rid of the toxic elements in the body. We've got to get the blood flow unobstructed. All of these things can be done over at Payson Health and Wellness Center with the techniques that Dr. Wyrick's got available, with the techniques that I've got available. We can make giant changes. Now, the Harvard Health. You ever hear of Harvard Medical School?
Oh, I think I have a time or
You
two.
ever heard of that? So they said, bothered by low back pain? You're not alone. An estimated 85% of people experience back pain severe enough to see a doctor at some point in their life, and it's a leading cause of disability worldwide. While standard care includes a balance of rest, heat, pain relievers, stretching exercise, and time, some doctors, these are MDs, also suggest terrific results after seeing a chiropractor. In 2018 study, researchers enrolled 750 active duty military personnel who complained of back pain. After 6 weeks of treatment, the study subjects reported less pain intensity, experienced less disability and more improvement in function, reported higher satisfaction with their treatment, and needed less pain medicine. That was a Harvard Health report. They have it in a health guide that they put out. By the way, my sister in Georgia sent this to me. She listens to the radio show every week. So we fix an awful lot of stuff that people don't realize that we fix. There's so much more information, but we're out of time almost.
Yep.
Heavens, this hour has gone so quick.
It has indeed.
Gee, I hope everybody listening has been helped by what we brought to you.
Well, I know I have, for one. So that's one in a row right there.
Well, we can do testing on you, evaluation of your function. We have free 15-minute consultations with either me or with Dr. Wyrick. And we're more than happy to tell you what we find, and then it's up to you as to what you want to do after that. There's no pressure. If you have Medicare, it will pay for spinal manipulation, but it won't pay for anything else. And if you want to pay for everything that we do, you've got to contact Dr. Congressman Gosar and Senator Sinema, as well as, those are two people from this district, as well as all the other congressmen and senators to pass the chiropractic legislation that allows Medicare to pay them for everything the state licenses them to do. We've been fighting this ever since I've been in practice. That's 57 years. And the medical cartel, and I'll call them what they are,
right?
Medical cartel, drug industry, they don't want us in there because as a chiropractic doctor, we don't use drugs.
Right.
As a naturopathic physician, I use drugs, but I use them in a physiological manner based upon how it makes the body work properly, not to cover up symptoms. Heavens, you've got a lot of MDs, DOs, and nurse practitioners that are really good at prescribing for that sort of thing. And that's wonderful. Every so often I use it too, to cover up a symptom. But I work at getting the problem fixed.
Right.
That's my whole approach. That's Dr. Wyrick's approach. And that's why he's a naturopathic medical doctor instead of an allopathic medical doctor.
All right. Well, it's been informative, to say the least. Give us that phone number there, Dr. Gear, to get in touch with you and get some help.
Well, the phone number is 928-474-7409. And we're there Tuesday through Saturday morning. And you leave a message for us Saturday afternoon, Sunday, and Monday, and we'll get back to you on Tuesday morning. We're more than happy to help you. Our location is right between the 260 Cafe and the American Legion, Payson Health and Wellness Center, and we're just west of Culver's. Do you know what Culver's is?
Mm-hmm.
Oh, you do? Those people are so busy. By the way, I treat people from all of those locations.
Outstanding.
So, and a few thousand more people.
All right. Well, thank you very much, Dr. Gear, Dr. Wyrick. It's been an interesting hour. I'm glad I was able to spend it with you all, and good luck to you, and we'll talk to you next week.
Very good.
All right. You've been listening to Doctor's House Call on KMOG.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.